Hello and welcome. Today we're diving into a common, yet often under-discussed condition, bladder neck contracture. We'll explore what it is, what causes it, how it's diagnosed, and the various treatment options available to manage this condition. Let's begin. So, what exactly causes bladder neck contracture? In most cases, it's a consequence of surgical procedures performed on the prostate gland. Transurethral resection of the prostate, or TURP, is a common culprit. But other procedures like radical prostatectomy or brachytherapy can also lead to this complication. The scarring that results from these procedures narrows the opening of the bladder into the urethra, creating a contracture. Less commonly, inflammation, infection, or even trauma to the area can contribute to the development of bladder neck contracture. To understand bladder neck contracture, we need to understand what happens inside the body. The bladder neck is the point where the bladder connects to the urethra, the tube that carries urine out of the body. When scar tissue forms at the bladder neck following surgery or other trauma, it narrows this opening. This narrowing, or contracture, creates an obstruction to the flow of urine. As the bladder struggles to empty against this resistance, the bladder muscle thickens, a condition known as bladder hypertrophy. Over time, this can lead to incomplete bladder emptying and a host of related problems. Bladder neck contracture primarily affects men, especially those who have undergone prostate surgery. It's estimated that anywhere from 2% to 10% of men who undergo TURP, for instance, may develop a bladder neck contracture. This number can vary depending on the specific surgical technique used, the patient's pre-existing conditions, and other individual factors. While it's less common, women can also develop bladder neck contracture, usually due to trauma or surgery in the pelvic region. The symptoms of bladder neck contracture can significantly impact quality of life. The most common symptom is difficulty urinating, often described as a weak or hesitant stream. Other symptoms may include frequent urination, especially at night, a sense of urgency to urinate, incomplete bladder emptying, and straining to urinate. In severe cases, it can even lead to urinary retention, where the bladder is unable to empty at all. Because symptoms can sometimes mimic other lower urinary tract conditions, it's crucial to consult a healthcare professional for a proper diagnosis. Diagnosing bladder neck contracture typically involves a combination of physical examination, medical history review, and diagnostic tests. A urine test will rule out infection. Uroflowmetry, which measures the rate and volume of urine flow, can help determine the degree of obstruction. A cystoscopy, where a small camera is inserted into the urethra to visualize the bladder neck, is often the most definitive diagnostic tool. This allows the doctor to directly observe the narrowed area. Ultrasound imaging can also be used to measure the amount of urine remaining in the bladder after urination. While there aren't distinct types of bladder neck contracture, they can be classified based on the severity of the narrowing. Some contractures are mild, causing only minor symptoms, while others are severe, leading to significant obstruction and urinary retention. The severity can influence the choice of treatment options. Treatment for bladder neck contracture aims to relieve the obstruction and restore normal urinary flow. Initial management may involve medications like alpha blockers, which help relax the bladder neck muscles. However, these medications often provide only temporary relief. Surgical options are often necessary for more permanent solutions. These include bladder neck incision, where a small incision is made to widen the bladder neck, transurethral resection of the bladder neck, similar to TURP balloon dilation, which uses a balloon to stretch the narrowed area, and, in rare cases, open surgery to reconstruct the bladder neck. The best treatment option depends on the severity of the contracture, the patient's overall health, and their preferences. Preventing bladder neck contracture starts with careful surgical technique during prostate procedures. Surgeons should strive to minimize tissue damage and scarring. In patients at higher risk, such as those with a history of previous bladder neck problems, preventative measures like postoperative alpha blockers may be considered. Careful monitoring after surgery and prompt treatment of any urinary problems can also help prevent the development of significant contractures. The prognosis for bladder neck contracture is generally good with appropriate treatment. Most patients experience significant improvement in their symptoms and quality of life after undergoing surgical intervention. However, recurrence can occur in some cases, requiring further treatment. Recent research is focused on developing less invasive surgical techniques, such as laser ablation and minimally invasive bladder neck reconstruction. There's also ongoing research into medications that can help prevent scar tissue formation after surgery. As technology advances, we can expect even more effective and less invasive treatment options for bladder neck contracture in the future.